in the last 7 days to manage the next phase of the pandemic's trajectory and progression, especially in the areas that where we have high density numbers. It would not be easy to cope by using the strategy we have used earlier on, where the pandemic is in the townships now. We need a ward-based response, including at ward level, to identify areas of high risk, shopping centers, shopping malls, public transport nodes where people are not observing regulations, are not observing social distancing, they are not wearing masks, spaces where our children play, spaces where people who would like to exercise are doing that. So we also want to make sure that at that ward-based level, we also include community leaders, sectors who will be represented, various sectors at a ward level. Because to tackle this pandemic at the scale that is required, it cannot just be government alone. Especially to get our people to change behavior, it can't be the police who go around policing the behavior of people. We would like social mobilization at community level for many people to understand, and leaders, including now that we are going to level 3, we're going to have various sectors of the economy open. We're going to have the religious places of worship, religious facilities will be open. So the ward-based team approach will also help us in ensuring that every place of worship in that ward, every public school in that ward, the schools are opening, every open space in that ward, every transport node in that ward is also monitored, as I said, including shopping centers and the spaza shops where our people come together. That this is a collective effort to ensure that we all comply with the measures, the hygiene measures. But the ward-based teams are also attending to other ailments. Those ward-based teams will also be dealing with the work that our teams ordinarily do. Our health team with the NGOs deal with HIV and AIDS. They deal with TB and other chronic diseases. So these ward-based teams will not just be dealing with COVID-19, because we know comorbidities are very much responsible for most of the death. So we don't want to ignore that. So if you want to understand the Gauteng hotspot strategy, is that it is a comprehensive strategy, firstly based on data. On a day-to-day basis, we receive this data. We break it down into the minute granular level, ward level, how many cases in that area. We also want these ward-based teams to be able to provide support to those who have tested positive. Instead of allowing the stigmatization of COVID-19, these ward-based teams will also be able to ensure that communities understand when you have COVID-19, you need support, you are still human, you will recover, yes, some may pass on, but we want to ensure we deal with stigma as well. We also want to use these ward-based teams will help us direct properly the efforts of where food support needs to go. You know, in terms of food, our food supply, we were having a general approach that's based on where the need is. But now we want to direct it also to where the problem of COVID-19 is. A ward that has got more COVID-19 cases in an area of high vulnerability where many people don't work, where many people are hungry, that ward will also receive more support from food security interventions, as well as other overall government support. So we now share with you data, some granular data that says to you in different areas of our province, in the different metros. In Johannesburg, we show you the data that shows you that a certain parts of Johannesburg, that included 4 ways, Diepsloot, Kayasand, Dainfen, Midrand, up to Lanseria was designated as a region in Johannesburg. It's Region A. That region was a big concern in the earlier days. But you'd see they only have 17 active cases at the moment. So whereas they have had 202 positive cases, they only have 17 active cases. The recoveries are so substantial in that region. Yes, we are continuing to monitor the areas there, even in that region, like Diepsloot, very closely, Kayasand. So we are showing you region by region. In Johannesburg, that's a sub-district. You go to Ekurhuleni, where were most of the cases. You would see what we said is it's Ekurhuleni 1, and Ekurhuleni, that's N1, that's the northern parts of Ekurhuleni, and the N2, both northern parts of Ekurhuleni, and Intswane. We're also showing you where most of the active cases are so that we can make our interventions. But you will now see, in that same, we show you that the West Rand, again, the sub-district called Mirafon City, that's where the mining outbreak has taken place. That sub-district has 130, in just one area, 130 cases have happened in one specific area. If you add them with that 83, that's where we have more than 240 active cases. So in 1 week, basically, you can have an area where the cases were few. In 1 week, that could change into many more cases. And that helps drive our interventions. We're also going to be doing this regularly to say to you the top 20 wards in Gauteng. In other words, the top 20 wards where we have more cases. And I want to explain to you that by more cases, sometimes the cases may appear few. Look at Carltonville. This is what the Mirafon, the mining area. So you may have a ward there that has got 23 cases. But if you take the whole area as a sub-district and add those cases, they will appear more. So we don't want to wait until a ward has got too many cases. That's the point I explained last week. And once we identify that in a ward there are this number of cases, very often for us 10 is big enough. When we have 10 cases in a ward or in a community, 10 is big enough to require a significant intervention from us. And you'd see we even track up to 4 cases in other parts of our province and our municipalities. So this is also changing. So the top 20 wards in Gauteng that have got more cases is something that is changing every week. Next week, we may present a different picture. You may find that there are a lot more recoveries in these wards, and another area has emerged as a hotspot. We will do the same. So when I said to you that we want ward-based teams that have information about where to intervene, to inform our testing strategy, to inform our tracing strategy, to inform where we need quarantine and isolation resources, to also inform where we are going to need more beds, people who may need hospitalization. This is based on data that's now being drilled to that level. We are further sharing with you the different wards. Again, the numbers may appear quite small, the number of infections. The point we are making here is that in this province, we are not just embarking on a program or a COVID-19 project without being informed by data. We are driven by that and interventions that we have to make. Every day when the results come, we sit down and do a breakdown. Where are these new cases coming from? what is it in that area we have not been doing, and what is it we can do to ensure we contain the spread and ensure that we protect an area that may have been green as of low infection rate. It's also our concern, like Sidibeng district has been a low infection rate district. We also want to make sure that in the areas where the infection rate has been low, we protect those areas by these non-pharmaceutical interventions. That includes continuing to ensure the social distancing in that area, hygiene measures are implemented, and all the health protocols are implemented in those areas. We map them. It's not enough just to give you the raw data. We also map this with geomapping. The geomapping of all cases in Gauteng is something we do very well. The size of the dot on our geomap will show you that it is emerging as an area of big concern. So just look at that Carltonville area. The dot is much bigger, and the dot indicates the number of active cases. You would see that Ivory Park area and the parts of Tembisa is where we were concerned last week. But those dots you see, those dots are smaller than the size of the dots in the West Rand, in the Mirafong area, because of the intervention that we are putting in place to contain that. And some parts of Soweto are included in that. Some parts of Soweto, including the Dobsonville area of Soweto, on the western side of Soweto, right up to Protreat Lane on the south, you would see the number of positive cases, but also we're getting recoveries out of those areas as well. So mapping where exactly these cases are is also very important to inform our interventions. I want to run through this usual update. There's a number of people who have been immunized in the last 8 days. There's 10,000 more people who have been immunized compared to last week. And again, with immunization is targeting those who are most vulnerable. We don't just immunize everybody. Firstly is the public health workers themselves, the elderly, the children, pregnant women, and people who have chronic diseases, including those with HIV and AIDS. Screening, we have now screened 5.6 million people. Our target was to screen 5 million people by the end of May. If you may remember, those of you at the beginning of May, we said to you that we want to screen 5 million people by the end of May. We have surpassed that target. We had said to you we want to be able to test 3,000 people a day. We have surpassed that target of testing. There are days that we test over 6,000 people a day in Gauteng, just as government, and this testing is targeted. Of course, I think we are concerned, like all provinces, we are concerned with the backlog on the results. And that's a matter that is being attended to by national government. The testing figures, we always give you an update on the testing figures. We get these figures overall, the national testing figures, we get them from the National Health Laboratory Services. Again, Gauteng contributes 33% to the overall national tests done so far, at 215,959 tests done so far. There's an important information that was released by the minister yesterday, which indicates the number of tests have increased, that 209,000 for Gauteng was the day earlier. We've just given you an update, including what is captured is only what's called community screening. Contact tracing, our province does extremely well. I'm going to give you an update on hospitalizations. The number of deaths remains the same in comparison to the rest of the country, other provinces. That's the national information released yesterday. So let's give you, as of today, an update on how many people are hospitalized in Gauteng as of today. there are 203 people, 203. 173 of those are in the private sector, and 30 are in the public sector. So there are 203 people who are admitted in our facilities, both private and public at the moment. 173 are in the private sector, and 30 are in the public sector. 5 of them are under ICU, they are in ventilation, they are under a ventilator, and others are on oxygen, basically. We have a full breakdown there, including on room air. So, on average, the number of people, every 7 days when we brief you, we have had, on average, 72 people in our hospital. You can see the number of admissions has increased, and it is a matter that we watch very, very closely. So when we have the large number like this, relatively larger than we have ever had before, it is a matter that we watch very, very closely, because it is out of the hospitals where we have people who recover and others lose the battle against COVID-19. So that's an important area. The number of people who have passed on is still 31. Again, this looking at the hospital admissions is important because clinical interventions happen there. Our clinicians spend a lot of time doing tremendously great work to ensure that they save life, even those who are admitted in hospital, and a lot more of them are able to recover and get back to normal life. The number of beds that are currently available in the public and the private sector, that number has not changed, 8,301. Additional number of beds have changed only slightly. We took you to the Ashanti Gold Hospital. That hospital, we had targeted 200 beds in that hospital that is being refurbished. We took you there on Wednesday. But the design of everything there, the number of beds have been revised from 200 to 175 beds. So initially our plan was to have 200 beds in that hospital. But because of the design, when you do ICU beds in particular, the design is different. So we have lost 25 beds out of that redesign. So the rest, the work is now underway, that work of refurbishing and building additional beds with alternative building technology in the various facilities in Gauteng province. Our PPE stock, you would see it there, it was 11.4 million. It has gone down to 11.2 million, but we always have to have stock on order in anticipation of more work, including in anticipation of the peak that is still ahead of us, so that we have enough stock on supply. I just want to give you an update in terms of the number of people. Since the start of the national lockdown in Gauteng province, we have distributed 166,349 food parcels across the province, covering 831,000 people in Gauteng. We want to reach 1 million people, and we are confident that we will reach 1 million people soon. Every week when we update you, we have additional number of people. Now we are diverting all this intervention, diverting them to areas of high risk and areas of vulnerability, including where we are now getting new cases coming, especially in the townships and the informal settlements. The number of the homeless people we are providing food to is still more or less the same, 3,126 people receiving 3 meals a day in the 47 shelters for the homeless in Gauteng. Last week we shared with you extensively the work we are doing with business. The only update we can give to you is that the mining sector has been our main focus. We continued this week to also to engage with the shopping malls in Gauteng, and we are classifying the level of compliance of all the shopping malls, designating them as green. Green is full compliance. Amber is the one, a shopping mall that has got some significant compliance, but not 100%. But red is a mall that's not complying. And in those cases, we are moving in where we have a mall that's not complying at all. We are moving in with law enforcement to ensure that if they don't comply, they basically have to shut down. So we have done a lot of work to look at compliance with level 4. We have done a lot of work to prepare for level 3. We have done grading of malls, as you would see them there, indicating which ones have been a problem for us and which ones have done better across the province. And we are doing checks, regular checks, not once-off checks. We are doing regular checks to just make sure there is a full compliance with the sector. These are some of the businesses where we had a problem. Farm-wise is the company that I was talking about in Centurion, where there was a cluster outbreak which caused problems for us in the Tembisa Ivory Park area, which got us to have significant new infections in that area. We made an intervention there, and we have also been looking at other businesses that are complying that we have visited so far.